My name is Christina Lee. I am the Research Associate for Knowledge Exchange for Disability Matters, working on Phase 7, Transforming Equity, Diversity and Inclusion through Disability. In this phase, we ask the question, what transformative knowledge pertaining to equity, diversity and inclusion can be generated through a focus on anti-ableist and anti-disablist practice? Or to put it simply, what exciting changes can be made in learning to make research more equal for everyone? In the context of research, knowledge exchange is about collaborations between universities and other organizations in public, private, and third sectors that creates positive change and benefits society and economy. For example, knowledge exchange can include running work placements, commercial partnerships, as well as delivering courses and workshops on new research findings and tools. Knowledge exchange is important in research because it allows researchers to share their work with funders, policymakers, entrepreneurs, and industry leaders who can then put research into practice and bring about positive changes in social policies and services. However, at the moment, disabled people are underrepresented in knowledge exchange. Many disabled people find it difficult to get involved in knowledge exchange because of a lack of accessible resources and accommodations to support them. Disabled people's lived experiences and knowledge of living with disabilities are often marginalized in knowledge exchange and seen as less valuable and unuseful than other forms of the knowledge. So, following the disability rights slogan, "Nothing about us without us," at Disability Matters, we are pushing back against these forms of exclusion by centering disabled people and disabled knowledge in our knowledge exchange work. As part of Phase 7, working together with colleagues and disabled people's organisations across the UK, Australia, Singapore, India, and Canada, we will be running a series of online town hall events and workshops to get more disabled people to contribute to and lead knowledge exchange. We will share our materials in easy read formats, use British Sign Language interpretation and live captioning, and make recordings available to ensure that disabled people are able to access and join in conversations that matter to them. The online town halls will share key research findings from each of the phases of the programme and spotlight work by disabled researchers and disabled people's organisations. Our first online town hall was held in September 2025, led by the Sheffield team. It was attended by over 50 people, including delegates from funders like Wellcome, NIHR and UKRI, national DPOs, EDI leads, as well as international researchers from Canada, Switzerland, Spain, Australia, and India. The knowledge exchange workshops will bring together representatives across sectors, from senior leaders at universities, researchers, EDI teams, charities, disability and health organisations, policymakers, and funders to explore key issues around disability and health. They will offer a space for extended discussions with stakeholders about how we can centre disability in EDI and create an inclusive future in health research. Our first two knowledge exchange workshops, organised in collaboration with colleagues from the Wellcome Anti-Ableist Research Culture Project, took place in March and April this year. The first workshop, Cripping Knowledge Exchange, looks at how we can use creative inclusive research methods to make knowledge exchange more accessible to disabled people. Our second workshop, which focused on inclusive research cultures and workplace environments, explored how we can use disability and as an opportunity to rethink work practices and create communities of care in the workplace. Through affirming the presence of disability in research as a disruptive force for innovation and positive change, we hope to transform knowledge exchange into a mutual and reciprocal practice and open up new possibilities for research that is truly in service to disabled communities and society.